This is a supplementary video to our postoperative instructions, although every patient gets postoperative instructions explain before the surgery, the day of surgery, after the surgery, the follow-up day after. We are all still nervous when we go to any type of procedure, and there's still questions how to do certain things. So today we're going to cover everything that I would tell you as a patient what to do after the hair transplant. First of all, right after the transplant, when you go home, eat and take your pain medication in case, just to preventive for that night, first night after the surgery. Sleep sitting up, prompted 4 pillows behind your back or a lazy boy chair. The purpose is to diminish possibility of swelling. Roll a towel, put it behind your neck so you have less tension in your suture line. Also, you can put a towel on your pillow to protect, a dark towel to protect your pillow, because we do expect some oozing from the back, from the suture area. It doesn't have to happen, but it may, so you want to protect your pillow. So the first night, and then you take sleeping pill before you go to sleep, since sleeping in a sitting up position is not really the most comfortable. So those are the things we say, I tell you the first day of the procedure. One more thing, if you drop something on the floor, you squat, you pick up, but you don't put your head down. Nothing to make blood rush into your head. Transplanted area is very fragile, and so you have to be very careful. First night, evening after the procedure, if you have to, you can put a hat on. If you don't have to, allow scalp to breathe and heal quicker, dry out and heal quicker. The next morning, we you can icing forehead, take the day slowly. Usually you can go back to your normal activities except doing any strenuous activities, no physical activities such as running or weightlifting for 7 days. You can do a light walk. If you're going outside, make sure you protect your scalp by wearing a hat. If you're a woman, you can wear a gentle scarf. You can wear a baseball cap. The idea is to protect your scalp from any possible sunburn. Once again, remember not to bend over and pick up anything from the floor. You can squat and lift it up, and nothing especially heavy. If you have any discomfort in a donor area, you can take ice. Jelly ice packs, you can have frozen peas, you can take crushed ice, put in a Ziploc bag. Make sure that no matter what type of cooling device you create, wrap it in a cloth and apply it into the back of your head, never directly onto your scalp, and never apply anything directly onto your transplanted area. And so the idea is that normally there's some swelling after hair transplantation, or any kind of healing will cause swelling. In the donor area, sutures may become more tense, so there's a little bit tension on a suture. The area can be a little bit more tender. If you ice the back for first 2 to 3 days, it could be more comfortable. Swelling in a forehead, if we are transplanting the top hairline at the top, there may be some swelling in a forehead, the bridge of the nose, eyelids. To prevent that swelling, you can apply ice on a forehead, once again, never on the top. And the idea is to apply as often as you think in first 2 to 3 days. If there is any swelling, it may appear 3 days after the surgery. Usually if swelling appears, icing will not help too much. To prevent swelling, Dr. Lamb will, he's always gentle in his procedure. He'll apply, infiltrate some special medication to diminish possibility of swelling. So we do everything we can. There's one more thing, you're sleeping, sitting up is also to prevent swelling. And so you can ice forehead as additional component in diminishing swelling. And if you do so, first few days, as often as you think, we say 20 minutes on, 20 minutes off. It could be 3, it could be 8 times during the day. As long as you're aware not to put ice directly onto your scalp, never on your transplanted area, and you can do on the suture area. You start washing your hair 24 hours after the surgery. So let's say your surgery was on Monday. You start washing your hair for the first time Tuesday evening or Wednesday morning. Do not wait too long. Some people are scared to wash hair. Do not worry about it. Using gentle shower pressure, regular shampoo, and gentle touch, you can wash your hair. So we're talking about washing hair. You can touch it. I always show and touch your scalp. You can touch, imagine touching baby's head. So you wash, you slightly massage the back where this donor area was or suture line is. Rinse it, towel dry, lift your towel gently, comb it gently, never scratch with a comb onto your scalp. You can style it, you can do blow drying, and also you can style if you're a woman and you need to style the tips of your hair, you can do that, but be very cautious not to burn your scalp. If you're using any styling products such as spray, you can use it or gel, you can use it 3 days after. For using any camouflaging products, you have to wait until all scabs are gone. We are talking 7 days after the surgery. If you have any discomfort, continue using your pain medication. Usually Tylenol can do it, or you can do a Vicodin or any stronger pain medication. Regardless to whether you use pain medication or not, use your sleeping pills if you have difficulty sleeping, and for the rest of the week, just go slowly with your physical activities. And this day 7 after the surgery, you go back to your normal hair wash. We're talking standing long time under the shower, and make sure you help your scabs start coming off. The scab will kind of hold around the hair, transplanted hair. So the softer the scab, the easier it will come off here. So this is very important. Since you were gentle for 7 days, and now I tell you 10 days, 7 days after, you can be rough with your hair. It's kind of a little uncomfortable. Remember, after 7 days, the scalp underneath the scab is healed. You just have to moisten the scab properly so that it can lift off your scalp and slough off. So stay under the shower a little bit longer. Massage your scalp a little bit stronger. And then when the scabs come off, usually small hair will stay in. It will be there for next few weeks. It can be up to 6 weeks that small hair will stay in, grow a little bit longer, and it will fall out. Don't worry about it. Sometimes with the scabs, hair can fall out. Don't worry about it. Hair root is underneath, perfectly sealed and secured. So between 7 and 10 days, most of your scabs should be gone. So once again, it is safe to be a little bit more vigorous about your hair wash after day 7. If you start noticing that, let's say you kind of had a scab that was tough to come off and there's a little bleeding around it, wait a day or 2, it will come off, so don't worry about it, but don't continue peeling it off. To summarize, it is easy, no strenuous activities for 7 days, gentle hair wash for 7 days. After 7 days, you go back to your physical activities normally. You go back to your hair wash normally. Now you can be vigorous. Still be a little gentle on the back until your sutures are out, and after that you can go to normal massage. And that would be all. It seems easy. Dr. Lame reminded me to tell you how to put a hat on. If we transplant the front, your hair is sticking up front. So you want to make sure you put your hat low here, and then you slide the back, and you take it this way because you don't want to lift the front and catch up your hair. Okay, if we're transplanting the back, you want to secure, you put the back lower, and then you slide the front. And when you're taking off, you hold the back so you don't want to catch. So just think about how hair is sitting, and you don't want to grab, by lifting your hat, you don't want to grab on transplanted hair and dislocate grafts. It should be easy, and never allow hat to be too tight, because once it's tight, it may pull the grafts with it. It should be simple.